Right, guys, this is part 2 of the OET speaking explanation, and if you haven't seen part 1, please do, because that will introduce what this topic is all about. Now, if you want, you can pause the video, check out the instructions here. This is for OET nursing, and this same strategy applies for any other case as well. You're a nurse, and you're basically talking to the parent of a little kid, so the kid is the patient, and you're going to introduce yourself, talk to this parent. Here is the roleplay card for the parent, who in this case is the interlocutor. So they're going to be talking to you as the parent of this patient, and they're going to address their concerns. My son is sick, and these are the conditions that developed, while you are going to be the one asking questions. Now, the first thing you want to do after the warm-up time, and again, we have discussed warm-up time already in the previous video in part 1, what you want to do now in part 2 is start with the introduction. Of course, you want to start with, hello, how are you? Just something very brief, unless it's an emergency scenario where you have to rush, get the details right away. You got to operate on this patient in 2 minutes. In that case, you would just get down to the details. However, those are rare cases. In this case, you would say, hello, Mr. and you can make up a name, Mr. Rockwell. It's Mr. Rockwell, right? The person, the interlocutor, will respond with yes. How are you doing today? Good, simple, okay? First, you want to, again, do the greeting. And next thing you want to do is do a confirmation question. Confirmation question is something like, it's Mr. Anderson, right? Or, I believe you're here to talk about your son's recent illness, correct? And then the answer is yes. So you want to start with greeting, confirmation question. Next, the best word I always recommend using is wonderful, because it just establishes a positive vibe. And I didn't cover this in part 1, but overall in OET speaking, you have to be very polite, very respectful, much more than you are in real life. And if you have been a doctor or you are in this medical field, in real life, we don't do it that much, but here you have to be extra and super polite. So, wonderful, let's get started. From here, you follow the question. Introduce yourself as a nurse and acknowledge the parent's visit. So again, you can make up whatever nurse you want to be. You can be the nurse at the triage or the senior doctor, etc. Avoid being a senior doctor because you are supposed to be a nurse. The thing here is medical knowledge does not matter. The terminologies don't matter. This is an English test, so the way you say it matters. This is an English test with a medical theme. That's all it is. So wonderful. Let's get started. My name is Dr. Alexander, and I'm here in the triage as a nurse. I understand that your son has been going through some abdominal pain and some nausea. That's why we're in the emergency department. Is that correct? Now here you can see we have not used the same words or the same sequence. We are paraphrasing, and you gotta paraphrase. Never copy and repeat the same question. Use your own wordings and explain the situation in your way. So now we have the cue card or the role play card of the interlocutor as well. This is what you can do at home. When you're practicing, you can see what kind of response they will have. So they will explain that their son has been experiencing all this pain for the past 6 hours, either at this point or from your next question. Maybe at this point, they'll just say, yes, nurse, doctor, that's what's happening. That's correct. So if that's the response, you can assume at home that that's possibly a response. Your next prompt says, inquire about the duration, location, and so on. Now, I would highly recommend asking only 2 questions at a time, even if there are many here, because you cannot cover so much and expect any human being to respond to so many questions in one sentence. So I would first ask about the duration and location. Once they answer, then I'm going to ask about the nature of the pain as well as the associated symptoms, making sure I am paraphrasing. Again, the first few questions usually are ask, ask, ask. That's easy. Later on, you'll get into provide reassurance, and words like, again, reassure. Make sure whenever you see these words, you actually act on them, because this is testing your emotional response, how you handle the situation, using words like, please don't worry, I'm sure we will be able to help your son out, or I assure you that we have a team of medical professionals who are available right now at your son's disposal looking at him. You can make up your stuff based on the scenario that is provided. So make sure you use that emotional language. Similarly, when the question asks you to explain something, that has to be longer than when the question says words like ask or inquire. Okay? Towards the end, how do you finish off? establish the parent's consent to return. So make sure you follow that instruction. It's not saying ask them to return. So hey, go to the waiting room. You have to establish the consent, which means, is it okay if you would go back to the waiting room and we will let you know when you're ready to be called in? Would that be okay with you? You have to ask, get the consent, all right? So make sure you follow the scenarios given and the instructions really well. These count towards a lot of marks, and this is how you can practice at home. Make sure to also look at the interlocutor's notes to see how the responses will come in. And if you have a friend or family member who can pretend to be the interlocutor using these notes, even better. All the best, guys. Please like, share, and subscribe. Talk to you soon.